Pelvic floor dysfunction doesn't always show up as pelvic pain. In fact, you may have subtle signs and symptoms without even realizing you have it. It can show up as different signs and symptoms in men versus women. And you may just think, oh, that's not pelvic floor. And I'm going to give you the warning signs that I think are so important. There are 5 warning signs I'm going to make sure you understand. If you have not subscribed to my channel, make sure you do. Also, make sure you go to the description box to see where else I exist on social media, because that's where I put the tips and alerts and different things throughout every single day. So let's talk about the first warning sign. The first warning sign is that you're constantly clenching your abs, your jaw, your glutes, and your pelvic floor. You're bracing without even realizing. In men, that clenching, in my opinion, happens a lot more. In women, it doesn't happen as much. I believe men hold their tension in the pelvis more than women. We tend to hold our tension in the neck and upper back, and in some women, it's also in the pelvis. I always tell my patients, and this is one of the things I always look when a patient walks into my practice. Jokingly, I say they walk with the pelvis first. In men, I see that a lot more. So it just seems like they've clenched their butt and their perineum, and it's like tucking their pelvis forward. Pelvis walks in through my door before the rest of their body. So that's just a presentation. A warning sign I just mentioned is pay attention to your perineum, pay attention to your butt. Are you clenching it? Are you not? Are you clenching your abs? Are you engaging that bracing without even realizing? The second sign or warning sign is pain with sitting or standing too long and shifting or fidgeting around. That means that your pelvis is unstable and you're trying to find comfortable position. That's what it translates into. So if you have pelvic instability, you have pelvic floor dysfunction. And the dysfunction can show up in different shapes and forms. If the dysfunction impacts your internal organs that reside inside your pelvis, this can show up as urinary or bladder malfunction, intestine malfunction, and uterus or ovaries or prostate dysfunction. A lot of times, men walk into my practice having been tested for sexually transmitted infection or being told they have inflamed prostate, and these are young people. So when that happens, you need to understand when the size of this inside changes because the muscles have tightened up, and they have tightened up in an attempt to try to stabilize the pelvis. When the housing of those internal organs is compromised, it's smaller, it's too small of a house for those organs, so things get squished. When they get squished, they're gonna malfunction. It typically shows up as bladder malfunction, then goes to intestinal malfunction, then it ends up impacting their uterus or prostate. It gets inflamed, prostatitis, inflammation of the prostate. When your internal organs like your intestine get squished or tightened, things just don't flow out. And so that's constipation. You go to the bathroom more often. You dribble. You go to the bathroom, you get up, and then you have to go again. Or you just went and you have to go again. You can barely hold your bladder. The easiest way to create more space here is by emptying the bladder, right? So you gotta chase the symptoms to the core. See, if you have the right environment for this body part to function properly. Warning sign 3 is trouble with bowel or bladder control. I just explained that to you. So These are the different presentations that people have. You may also now go to warning sign 4. You may have lower back issues, chronic lower back issues, chronic hip mobility issues, chronic groin tension. You may have tension basically in how you move around and do things. Those are dysfunctional patterns of movement impacting your joints. And finally, you may have difficulty with breathing. What I'm referring to is not like your shortness of breath, but it is. You catch yourself holding your breath, or you catch yourself having to take a deep breath in like you're out of breath. The dysfunctional patterns of movement exist. The beginning of the dysfunction happens with a modification in how you breathe. The way we are to breathe is referred to as biological breathing by yours truly. I came up with the word. And that's because I don't want to use belly breathing, because I've seen people do it wrong. Biological breathing is the breathing that kids do, newborns to a few years of age do, when we study human babies, no matter what part of the world you're from. When we study the patterns and the things that are in place for biological breathing, we see how important it is for your posture. It's so important for the muscles inside the pelvis, for your internal organs to have a healthier environment. When you breathe biologically, every breath in relaxes these muscles. Every breath out or expiration is these muscles contracting. So at a frequency of every breath, you're conditioning these muscles. And that is so important and is being reminded continuously, because this is a foundation to the structure above. Without the structure above, you're not existing. So when it comes to pelvic floor dysfunction and different phases of it, we gotta pay attention to the subtle signs. The more the subtle signs you have, the deeper the problem gets. So then when the symptoms come and the tests show negative findings, the providers throw their hands up in the air like, I don't know. And then they send you to a pelvic floor physical therapist. And the teaching of pelvic floor physical therapy is primarily internal work. That's work through the anus and or vagina. Frankly, if that was the only way nature handled it, then we'd all have a finger up our anuses and vagina, right? But that's not the case. So we are to provide what makes sense to me. And what I do with my patients is I work on creating pelvic stability using how nature does things. How do I know how nature does it? I look at babies, what they do naturally. They could barely hold their heads up, and somehow they become running toddlers. That means their pelvis was stable, their posture was stable, their feet and ankle were able to manage and balance the structures above. So if I look at how they do that, and I see that every human being on the planet Earth has gone through those steps, it's fair to say that those steps are the manual of movement. So then, how does this individual compare to the manual? I always say every manual has a troubleshooting section. The questions are different in that section, but the manual is applicable to every problem. So hopefully this makes sense. If it does, please type makes sense. Do understand your body is here to serve you. At least when it comes to these types of things, I can feel comfortable to say that when it comes to movement, stability, posture, these are the right way, this is the right way of looking at it. We don't want to miss this serious pathology. But do understand that people come to my office, at least, when they've already gone through a whole bunch of tests. They've all gone through the standards of care for these types of issues, and clearly the problem is still there. So they come to me with a chronic condition, most often, if not always, as a result of failure of proper treatment, because the treatment did not address the root cause. If you have not subscribed to the channel, make sure you do. If you're not following on social media, you may want to reconsider. And if you have any questions, comments, or suggestions for future videos, please use the comment section on this video so I can address them. Thanks for watching.